Nowadays, colon cancer has become quite common. People are yet to try to cope up with this condition and are learning more about it. If you are also among those people, then you are in the right place. Hello everyone, and welcome to my channel, where you learn everything about health and well-being. A colonoscopy is an exam used to detect changes or abnormalities in the large intestine, colon, and rectum. During a colonoscopy, a long, flexible tube is inserted into the rectum. There are many undiscovered things about colonoscopy. Therefore, in today's video, we will share with you 10 things that you must know about colonoscopy. Before we begin with the video, please take a moment to subscribe to the channel. And don't forget to hit the bell icon so you get notified when I come back with another amazing video. Without any further ado, let's jump into the video. 1. Colonoscopy is an examination that allows a doctor to carefully examine the inside of the entire colon and rectum to find polyps or signs of cancer. Polyps are small growths that can become cancer over time. The doctor uses a flexible, hollow, illuminated finger-thick tube with a small video camera. This tube, called a colonoscope, is gently released inside the large intestine and sends images to a television screen. Special instruments can be passed through the colonoscope to remove small polyps or, if necessary, to take tissue samples. 2. Bowel preparation is a process that aims to cleanse the large intestine as much as possible so that the doctor can clearly see the inside and get good pictures. Preparations may include a special diet, drinking up to 1 gallon of liquid laxative, medications, and sometimes enemas that often force you to go to the bathroom. You may also be instructed to stop taking some over-the-counter or prescription drugs. Remedy up to a week before the test. 3. Colonoscopy can be performed in a doctor's office, hospital, clinic, or surgical center. The tests are usually performed in a private room. 4. The colonoscopy itself takes about 30 minutes. Patients are usually given medication to help them relax and sleep while it's done. If so, you will not be allowed to drive afterward. So someone you know must go with you and take you home. You will also need to plan to stay home on the test day until the medication is gone. 5. Most people do not feel pain during any of the tests, but may then experience cramps or discomfort due to the air that was inflated into the colon during the test for the doctor to examine. 6. If a small polyp appears during a colonoscopy, your doctor will probably remove it during the test. If the polyp is too large to remove or has an abnormality that looks like cancer, your doctor will remove a small piece from it to see if it contains cancer or precancerous cells. The results of this tissue analysis will determine if you need additional procedures or treatment. 7. If nothing is found, you can go up to 10 years without another test. People over the age of 75 should talk to their healthcare provider about whether they should continue screening. If something is found, you may need more frequent tests or treatment. 8. Colonoscopy, more than once every year or 10 years, is usually not necessary. Grape-like growths or polyps in the colon or rectum are common in adults and usually harmless. But some polyps called adenomas can eventually turn cancerous. Healthcare providers can detect and remove polyps during a colonoscopy using a soft, lighted tube to examine the colon and rectum. If the test does not find an adenoma or cancer, and you have no risk factors for the disease, your chances of developing the disease are low in the next 10 years. That's because the test misses very few adenomas, and colorectal cancer grows slowly. Even if 1 or 2 small, low-risk adenomas are removed, you're unlikely to develop cancer for at least 5 years, and having the test repeated earlier will offer little benefit. 9. Colonoscopy is a safe procedure, but sometimes it can cause heavy bleeding, a tear in the colon, inflammation or infection of the pouches in the colon called diverticulitis, severe abdominal pain, and problems in people with heart or blood vessel disease. Some complications can lead to blood transfusions, surgery, hospitalization, or rarely death. Testing also has its disadvantages. You must limit your diet and take laxatives before that. And because the exam requires sedation, someone has to drive you home. And you could miss a day of work. So, you don't want to check more often than necessary. 10. Most people should start screening for colon cancer at age 50. If colonoscopy doesn't find adenomas or cancer, and you don't have risk factors, the next test will be in 10 years. If 1 or 2 small, low-risk adenomas are removed, re-examination in 5 to 10 years is recommended. Ask your healthcare provider when and how often to have a colonoscopy if you have inflammatory bowel disease, history of multiple, large, or high-risk adenomas, or a parent, sibling, or child with colorectal cancer or adenoma. Routine screening is usually not needed after age 75. So, these are 10 things about colonoscopy that we all must know. Would you like to add more to the list? Let us know in the comments section below. If you found the video helpful, give us a thumbs up. And don't forget to share the video with your friends and family. Thanks for watching.